Hey everyone, thanks so much for joining me on the Commercial Carrier Corner. I'm your host, Jared Taylor. Joining me today is Jonathan Mosse. Jonathan, how's it going?
Great, Jared. How are you? Thanks for having me today.
Doing well. I'm excited to chat. Let's dig right in. Tell the audience a little bit about yourself, and then we'll go into our discussion here today.
Sure. I've been in the health insurance and employee benefits industry for 35 years now. The first 30 years of my career were as a broker. My dad, my brother, and I built an insurance agency north of the city of Boston that we operated. We did solely employee benefits. I ran the health and welfare practice for 30 years. I retired in 2019. We bought and sold our agency a couple of different times, and I retired in 2019. Um, with a vision to truly being retired, but folks in the industry called me and pulled me back in a variety of capacities. So now I consult to the industry in a variety of ways. Pharmacy benefit management. I do some consulting to insurance companies like Imagine 360 and others. And then ultimately, I've worked with a couple of friends of mine to help them build out some medical stop loss captives, which is, I think, what you wanted to talk to me about today.
What I found is the best people don't stay fully retired for very long. So it's I'm sure you also are enjoying still being involved with a lot. You don't strike me as the type of person that once you decide to retire, you're not going to do anything else. So
Well, I made
let's
a promise to myself that if I thought it was fun and interesting, I would do it, and if I didn't, I wouldn't. So far, I've been pretty true to that. There are things that people have approached me with that I just found interesting and enjoyable. So I've gone down the line with them.
I love it. Well, let's dig into the conversation here today then. So first off, let's start. What is a captive?
So I think when in the context that you're probably interested in, so a captive is an insurance company. Originally, it was a single parent captive. In other words, a company would have a risk that it couldn't place effectively or cost effectively or coverage wise effectively in the open market. So it would start its own insurance company. So it would manage its own risk through its own insurance company and handle the risk that way. So that was the origination, a single parent captive. So over time, captives, there's just been dozens, if not hundreds of different applications of a captive insurance company. Essentially, it's a company owned by either one person or members of the captive to basically bear the risk that it's decided to place within it. It's not looking to sell out into the open market for commercially or on a retail basis. So it's usually specific to a particular risk or risks, either on behalf of one insured, being that single parent or multiple. So in the case I think we're talking about in the Imagine 360 universe, we'd be talking about generally speaking, a group stop loss captive. So specifically, the captive would be handling the risk of medical stop loss. I think there's some misconception when people want to get into captives that are in the health insurance arena that it's handling the entirety of the risk, all the first dollar risk. And in real true application, the captive is handling the stop loss or the reinsurance component of a self-insured medical plan. That's the only piece that's going through the captive.
Jonathan, why is it that the traditional approach to captives didn't work? Like, why is that the case?
Well, I think certainly people have applied medical stop loss captives in a different way, and a number of them have worked, right? I think a lot of the industry specific captives have done very well, right? And I think even some of the broker captives have probably done better than others. But I think there are certain captives, and the way that it was thought out was really, hey, let's just place all the stop loss business together, and this sort of aggregation of large numbers will make the whole perform better, when in reality that won't necessarily happen, right? If you have a lot of negative risk and you've just packaged it together, well, now you have basically a huge pile of negative risk, right? So it's, what did you do in the programs and what other mechanisms have you put in place to better manage that catastrophic risk and generate better underwriting results on behalf of the members, right? If you just are generating the same results, then what did you do it for, right? There's a lot of work involved in the captive. There's a lot of frictional cost with actuaries, accounting, the captive facility itself. So if you haven't really done a better job at managing that catastrophic risk, it really doesn't deliver what you want it to deliver. So in certain cases, people did them as a tricked up way to sort of insulate their business or try to protect it from market competition, but the reality of it is there's always going to be market competition. So if you haven't really managed your captive better, what did you really do? So I think that too many captives sort of let the members decide what they would do with their program. In other words, go ahead and you select whatever administrator you want. You do different cost containment programs. And if I'm a member of a captive and I'm truly trying to operate more effectively and efficiently on behalf of and with my partners, I really want to make sure my partners are thinking and acting the way that I'm thinking and acting, right? Why do I want a partner who doesn't care about their losses, who isn't concerned about the health and well-being and the delivery of services to its membership? If I'm a partner with that person, I'm doing all the right things and they're not, in my estimation, doing those similar things. Why do I want to be their partner?
And let's you mentioned it already a little bit, but let's continue to dig deeper. What's your current approach to captives? And I can already tell that you, based on what you've already said about why the traditional approach doesn't work, why it's different. But if you want to add some more tidbits onto that, we'd appreciate that.
Sure, not to be overly pithy, but I think my approach is that all for one for all mentality, right? So I want to make sure that as people come into the captive, they're all coming in for the same reasons. So I think the most important thing in my mind in a captive is building a program structure, not just the insurance element of the stop loss in the captive, but really building an underlying program structure that thinks about managing cost and managing risk from the first dollar on up. So I'm looking at what cost containment solutions can I apply to get the most favorable results on behalf of the members, meaning the individual plan participants, the company or corporate members who've joined the captive, right? And then ultimately the captive itself, right? So how do you put together the right programs that will deliver the best possible results across the entire breadth of the program? So, and if you're managing all the risk from the first dollar on up, you've automatically better managed your catastrophic risk, right? So if I'm being effective on a service that costs $1,000, I can't help but be effective on a service that costs $100,000, right? So let's think about that all the way from the first dollar on up. We're not really asking members of the captive to select various cost containment structures and programs from a menu. We're delivering the menu and saying, here's what you are obligating yourself to, and here's what all of the other members in turn are obligating themselves to as well, so that you can look across the table at your partners and saying, yes, we're all doing and acting exactly the same way. So we should expect results that are commensurate with all of those actions, right? So if you are truly able to get members to join your captive who all think and act alike, you can only help but be better. Right? And it will help the members share experience and to further evolve your captive as different cost containment options and opportunities present themselves to the marketplace. Now you're in a better position to act upon them because you're all thinking and acting the same way, right? It doesn't mean there aren't discussions and disagreements on what that same way should look like, but at the end of the day, you're all going down the roadway in the same path. You're not running contrary to each other, and that's only going to help in generating positive results. And frankly, the way that the captives I've worked with have been structured are, if you don't like that, don't join, and that's okay, right? This is a buying decision. We think if you make a buying decision, if this makes sense to you, wonderful. Come on into the captive. And this is really all about sort of thinking and acting differently. If you want to think and act the same way that hasn't worked for you in the past, why don't you just go do that somewhere else? Not to be mean spirited, but right, why are you joining this? There's nothing in it for you.
100%. Well, Jonathan, I want to thank you for sharing your thoughts with us here today and look forward to having you on again in the near future. We can dig even deeper, but thank you so much for your time.
Oh, thanks, Jared.